Every single person alive today experiences something that wasn't widely considered a medical disorder until the late 1800s. Before that era, humans experienced fear, worry, and dread for thousands of years without anyone calling it a mental illness. The ancient Greeks had a word for persistent worry. They called it melancholia and thought it came from too much black bile sloshing around in your body. Medieval monks described overwhelming terror but blamed demons. Even in the 1800s, doctors just called chronic worry nervous disorders and prescribed rest cures. Then, in 1869, an American neurologist named George Miller Beard described something he called neurasthenia, and suddenly, anxiety began its transformation into something medical. Hi guys, I'm Monty and I'm a linguist and a history enthusiast. I create videos that give you a new perspective on modern concepts. If you learned something from this video, please consider liking it and subscribing to my channel to help me grow and create more of this kind of content. And let me know in the comments what you'd like to see me talk about in my next video. This isn't just word games. When we medicalized anxiety, we completely changed what it means to be human in the modern world. We took experiences that every civilization had understood as normal responses to life's uncertainties. You know, being alive and aware that terrible things can happen, and reclassified them as symptoms requiring treatment. Today, anxiety disorders are diagnosed in 40 million American adults. That's nearly 1 in 5 people. What's troubling is that the symptoms we're treating haven't changed. What changed is our interpretation of them. Here's what's wild. The exact same feelings that send modern Americans to therapy were once understood as spiritual trials, character flaws, or just part of being human. Did we discover anxiety disorders, or did we invent them? Ancient Mesopotamian texts describe people experiencing what we'd recognize as trauma symptoms: sleepless nights, intrusive thoughts, overwhelming fear after witnessing destruction. We'd call this PTSD today. They called it what happens when you see your city burned to ash. Herodotus wrote about Epizalus, an Athenian warrior who survived the Battle of Marathon in 490 BCE but went suddenly blind after watching his companion die beside him. No physical wound, just blindness that lasted years. Ancient Greeks didn't diagnose him with trauma-induced conversion disorder. They understood that witnessing horror could break a man's sight, and they accepted this as part of war's cost. The Greeks did have medical theories about persistent worry. Hippocrates, writing around 400 BCE, described people consumed by irrational fears and called it melancholia. The term comes from melas, meaning black, and chole, meaning bile. He believed an excess of black bile caused both sadness and anxiety. But here's the crucial difference. Hippocrates saw melancholia as a temporary imbalance, not a lifelong condition requiring endless management. Even more telling is how they treated it. Ancient Stoic philosophers like Epictetus developed techniques that sound remarkably like modern cognitive behavioral therapy. They taught people to examine their thoughts, question catastrophic assumptions, focus on what they could control. But they framed this as philosophy, not medicine. They were teaching wisdom, not treating illness. The Romans continued this tradition. Cicero wrote extensively about anxiety. He actually used the word anxietas, but positioned it as a moral failing, not a medical condition. If you were consumed by worry, you needed better character, not better treatment. Seneca advised anxious Romans to practice something called premeditatio malorum, deliberately imagining the worst outcomes to reduce their emotional impact. Again, this was education, not therapy. For over 1,000 years after Rome fell, anxiety remained in the realm of religion and philosophy. Medieval Christians understood persistent worry as either a test of faith or the result of spiritual weakness. The Desert Fathers, early Christian monks living in extreme isolation, described overwhelming terror and despair in vivid detail. But they called it acedia, spiritual sloth, and treated it with prayer, fasting, and community support. Thomas Aquinas, writing in the 13th century, analyzed anxiety with scholastic precision. He distinguished between reasonable fear and excessive worry, but placed both firmly in the moral realm. Anxiety was a vice to be overcome through virtue, not a symptom to be managed through treatment. The first crack in this framework appeared in 1621 when Robert Burton published The Anatomy of Melancholy. Burton was an English scholar who spent his life compiling every known description of what we'd now call depression and anxiety. His book was massive, over 900 pages, and it marked the beginning of anxiety's transformation from spiritual condition to medical curiosity. Burton still used religious language, but he approached melancholy like a natural philosopher studying any other phenomenon. He catalogued symptoms, proposed causes, suggested treatments that mixed medical remedies with moral advice. Crucially, he began to separate the experience of persistent worry from questions of personal virtue or spiritual standing. But the real shift came in the 1600s and 1700s, when European physicians started systematically categorizing mental distress. They coined terms like nervous disorders, vague labels that medicalized emotional suffering without really understanding it. Women were especially likely to be diagnosed with hysteria, which doctors believed was caused by their uterus literally wandering around their body. The Greek root hystera means uterus, and physicians theorized that this organ could become displaced and affect other parts of the body, causing anxiety, panic, and irrational behavior. The treatment for hysteria shows how primitive medical understanding remained. Doctors prescribed pelvic massage to guide the uterus back to its proper position. They recommended marriage to calm the wandering organ. Some even suggested fumigating the vagina with pleasant-smelling herbs to lure the uterus downward. These weren't fringe practices. They were mainstream medical treatments endorsed by respected physicians. Men weren't immune to medicalization, but their anxiety was usually attributed to different causes. Male worry was often diagnosed as hypochondria, not the modern meaning of excessive health anxiety, but a condition believed to originate in the hypochondrium, the area below the ribs. Doctors thought anxiety arose when vapors from the spleen contaminated other organs. Vapors from the spleen. But then in 1745, everything shifted when French physician Boissier de Sauvages published the first systematic classification of mental disorders. His nosology included something called panophobia, literally fear of everything. He described it as intense nighttime terror that strikes without apparent cause, accompanied by racing heart, sweating, and overwhelming dread. Modern psychiatrists would immediately recognize this as panic disorder. But Sauvages went further. He identified subtypes of panophobia that match contemporary anxiety diagnoses with startling accuracy. One subtype involved constant worry about health despite no physical symptoms, essentially hypochondriasis. Another featured persistent, generalized anxiety about daily life circumstances, what we'd now call generalized anxiety disorder. This was revolutionary because Sauvages treated anxiety as a legitimate medical phenomenon worthy of scientific study. He wasn't dismissing it as moral weakness or spiritual failing. He was saying these are real conditions with observable patterns that medicine should address. The 1800s saw this medical approach accelerate rapidly. In 1869, American neurologist George Miller Beard described a condition he called neurasthenia to explain what he saw as a distinctly modern form of nervous exhaustion. Beard argued that the pace and complexity of industrial civilization were overwhelming the human nervous system, causing chronic anxiety, fatigue, and irritability. Neurasthenia became wildly popular as a diagnosis. It explained why so many people in rapidly modernizing societies felt constantly on edge. It suggested that anxiety wasn't a personal failing, but an understandable response to unprecedented social conditions. Beard's patients included prominent figures like Theodore Roosevelt and William James. Anxiety had become respectable. But now the story gets complicated. The same symptoms that Beard called neurasthenia had existed for millennia. What changed wasn't human psychology, it was the framework for interpreting psychological distress. Medieval monks experienced the same racing thoughts and sleepless nights that Beard's patients reported. Ancient warriors suffered the same intrusive memories and hypervigilance that we now call PTSD. The difference was context. When anxiety was understood as spiritual trial, people endured it as part of their relationship with the divine. When it was seen as character weakness, they worked to overcome it through moral discipline. When it became a medical condition, they sought treatment from doctors. The experience remained constant. its meaning transformed completely. Then everything changed in the 20th century. Sigmund Freud introduced anxiety neurosis in 1895, arguing that repressed sexual energy manifested as chronic worry and panic attacks. Whether or not you buy Freudian theory, his work established anxiety as a proper psychiatric condition with psychological causes and talking cure treatments. World War I and II created millions of men with what we'd now recognize as severe PTSD, but military psychiatrists called it shell shock or war neurosis. These diagnoses legitimized psychological trauma in ways that previous frameworks couldn't. If brave soldiers could develop anxiety disorders from combat, then anxiety clearly wasn't just personal weakness. The pharmaceutical revolution of the 1950s completed anxiety's medicalization. When Miltown, the first mass-market tranquilizer, launched in 1955, it was marketed directly to anxious Americans struggling with modern life's demands. Suddenly, anxiety wasn't something you endured or overcame through character development. It was something you treated with medication. The creation of the DSM-3 in 1980 formalized this medical model. For the first time, anxiety disorders appeared as an official psychiatric category with specific diagnostic criteria. Generalized anxiety disorder, panic disorder, social phobia, conditions that had been lumped together as neurasthenia or nervous exhaustion became distinct medical entities requiring different treatments. This changed everything. When anxiety became a disorder, it also became a market. Pharmaceutical companies developed increasingly sophisticated drugs targeting specific neurotransmitter systems. Therapy became a medical intervention rather than philosophical guidance. Insurance companies started covering anxiety treatment as healthcare rather than personal development. But the medicalization of anxiety also created new problems. When normal human responses to uncertainty become symptoms of disorder, we risk pathologizing the entire human condition. Every parent worrying about their child's safety, every student anxious before exams, every worker concerned about job security, all potentially become patients requiring treatment. The numbers are staggering. Today, anxiety disorders affect 40 million American adults annually. That's nearly 20% of the population diagnosed with conditions that didn't exist as medical categories 150 years ago. Either we've discovered a massive public health crisis that previous civilizations somehow missed, or we've medicalized normal human experiences that every society has always managed through non-medical means. So did anxiety exist before the modern era? The answer depends entirely on what you mean by anxiety. The experience, that tight chest, racing mind, sleepless dread that comes of being human in an uncertain world, has existed as long as consciousness itself. Ancient texts describe it in vivid detail. What didn't exist was the idea that these experiences constitute medical disorders requiring professional treatment. We didn't discover anxiety, we invented anxiety disorders. And that invention has been both liberation and trap. Liberation because it freed people from shame about psychological suffering and provided effective treatments. Trap because it transformed natural human responses into pathological symptoms, creating a medical industrial complex that profits from our fundamental vulnerability to fear. The next time you feel that familiar knot of worry in your stomach, remember, your ancestors felt exactly the same thing. They just had different stories about what it meant.